Welcome to the webinar today. I'm Dr. Tara McCannell. I'm the director of the Ophthalmic Oncology Center at UCLA, and I'm a professor of ophthalmology in the Department of Ophthalmology at the Stein Eye and Doheny Eye Institutes at UCLA. And it's a privilege to be here to speak to you about ocular melanoma survivorship. In this video, I'm going to be talking about important considerations for ocular melanoma survivors, including things you can do to promote your ocular health, your physical health, and your mental health, no matter how recently you may have been diagnosed or received your treatment. Here at Jules Stein Eye Institute at UCLA, we have historically held three priorities in our care for patients who are diagnosed with ocular melanoma. Our first priority is to save life and promote long-term survivorship. Our second priority is to do everything we can to save your affected eye. Our third priority is to save your sight and maintain it over time, including the quality of your vision, managing any possible side effects from the cancer and its treatment, as well as doing things to improve your overall visual quality of life. As you may or may not know, we at the Stein Eye Institute have been pursuing health psychology research with the psychology department at UCLA. Health psychology research seeks to bridge our understanding of how mental and physical health influence one another. Our research has examined how receiving a diagnosis of ocular melanoma has influenced mental health and well-being over time. For example, we conducted a study with patients here at the Stein Eye Institute where we sent them questionnaires about their experiences with ocular melanoma to understand their needs from the time of diagnosis up to 1 year later. If you have been a patient here at the Stein Eye Institute for several years, you may have actually participated in this study. We published our results of the study in a paper by Timothy Williamson and colleagues in the academic journal JAMA Ophthalmology in 2018. We found that ocular melanoma survivors felt that they had a high level of unmet needs related to information about their illness, as well as psychological support surrounding their experience with eye cancer. Thus, we learned that ocular melanoma patients at UCLA need more information about their illness as well as resources to help address mental and emotional health. This research has made us increasingly dedicated to providing ocular melanoma survivors with informational resources and psychological support. We believe that providing patients like you more information about ocular melanoma, as well as resources for improving visual, physical, and mental health, will not only address ongoing needs for information and psychological support, but also help us uphold our priorities of saving life, eyesight, and saving your eye. Today's video is the first of a 2-video series that we have developed to provide survivors like yourself with important information about how you and your doctors at the Stein Eye Institute can take steps to promote your long-term physical, visual, and mental health. In this first video, we are going to be focusing on important considerations for ocular melanoma survivorship, including information about how your doctors can help to promote your ocular and physical health over time. Ocular melanoma is a highly treatable form of cancer when we are able to detect it early. Advances in imaging technology have allowed us to detect even incredibly small tumors, something that we didn't have available even a decade ago. Luckily, even if tumors are detected when they are on the larger side, our current treatments such as radiation with plaque brachytherapy can usually successfully treat the initial tumor. Because of the high degree of success of our treatments in destroying the tumor, recurrence of ocular melanoma in the affected eye is actually rare at our institute. Even in rare cases, when we see the cancer coming back, we are able to detect the regrowth early on, and our studies and evaluations can still help you even in standard follow-up visits. This is one reason we at the Stein emphasize the importance of receiving close follow-up exams from us here from your treating retinal specialist, myself, every 6 months. Being able to evaluate your eye health and collect images and data on how the tumor is responding to the treatment helps to detect and potentially address recurrence if that were to happen at the earliest possible moment. In the rare cases where we have seen recurrences, we are usually able to catch the tumors early and apply secondary treatment to contain the tumor and achieve local control. Furthermore, Our suggested twice-yearly visits with us allow us to help attend to your overall vision and explore your fellow eye to make sure that easily treatable conditions that are more common than ocular melanoma are addressed and managed. While treatment for ocular melanoma is often highly successful and usually completed within a matter of a short time after diagnosis, we do understand the long-term consequences that survivors face due to the results of the cancer and its treatment, as well as the uncertainty that you may experience about how your vision may change over time. At our twice-yearly visits, the tests that we do and the evaluations that we have to monitor for the side effects and your cancer, such as radiation retinopathy, allow us to offer treatments that may be helpful for your care. For example, the imaging and evaluations that we do can offer solutions that may be able to help and improve your vision. In turn, we can also take action to provide early treatments such as laser, injections, and continued close monitoring to monitor and manage any side effects. All right, let's now take some time to discuss the topic of visual impairment, the impact that ocular melanoma and its treatment may have on your vision. It is typical for ocular melanoma survivors to notice visual impairments in their affected eye. However, the degree to which people experience these impairments ranges from person to person and may vary in time from when the tumor was treated, as well as be related to the size of the tumor at discovery. When tumors are more centrally located in the eye, such as affecting your central vision, as well as larger in size, both the tumor as well as the radiation we use may affect your vision. That being said, it is hard to tell for sure how much vision may be impaired, as various people respond in different ways. However, it is true that most of us, because these changes are gradual, tend to adapt and adjust to impairments very well over time. No matter how much impairment or the degree to which you may feel your experience has affected you, we are committed to maintaining whatever we can of your visual functioning and your visual quality of life. Blindness or total vision loss in the affected eye is actually relatively rare as a result of ocular melanoma and its treatment. Because of our advances and the things that we do to help maintain and save your vision, this is the result for most of our patients. For example, we use radiation plaques that are designed specifically for your tumor. And for some patients who have larger sized tumors, we do place an oil bubble in the eye because it is one way that we can be preventive and actually shield radiation from affecting the healthy parts of the vision in your eye. In cases where patients experience significant loss of vision in the affected eye, we do see that most people are able to maintain some degree of peripheral vision and that this can be a huge benefit in your vision. You may notice that you might not be reading well on the eye chart, but we actually don't have accurate ways of measuring your overall visual function. Peripheral vision is a critically important way to help people continue to do the activities they do in everyday life. Furthermore, we are able to offer a number of treatments that can maintain and even promote vision in your affected eye. There are medications that can help address poor vision that our team can help you with. There are visits to the optometrist who may be able to help with a refraction or a glasses correction that can help to improve your vision. We can also help treat other conditions that can happen at the time of your treatment, such as persistent floaters, the development of a cataract, and even treating conditions such as glaucoma that are much more common than ocular melanoma, but that are important if we are to maintain the best possible vision in your eye. Finally, we can help treat more temporary forms of visual impairment, such as considering the use of eye exercises which can prevent double vision. Even using the eyes together and being conscious about using your eyes together can be a form of visual therapy. That being said, the best way to help the eye and its vision is to just use the eye as you normally do. Once the brachytherapy plaque has been removed from your eye, we encourage people to go right back to normal. Use your eye as though nothing has happened. This will actually hasten your recovery the best. No matter how much impairment you may experience, we are confident in our ability to help you maintain the vision that you do have in the affected eye. It is important to note that one's overall vision is a combination of what your brain takes from both your eyes. So even if your treated eye is weaker than your better eye, when you use the eyes together, most people are able to continue and do the activities that they enjoy. As an ocular melanoma survivor, your affected or untreated eye in virtually all cases will be your stronger eye. It is important for you and we as your doctors to do everything we can to maintain and promote the health and sight in that eye and your better seeing eye. Not only is your strong eye going to be important for helping and maintain the clarity of your vision, but it is also important to support anything we can do to improve or maintain the vision in the eye that was affected by the ocular melanoma. Most people report that their overall vision allows them to continue going about their lives as usual, especially when the health and sight of your unaffected eye is maintained with proper follow-up and care. Again, this is why we at the Stein Eye Institute recommend that people who have a history of ocular melanoma see a retinal specialist, an ophthalmologist with expertise in the back of the eye, every 6 months to maintain the health of your eye indefinitely. Routine follow-up visits can not only address the health and vision in your affected eye, but it is important to monitor your fellow eye as well. As we get older, our vision can decline even without experiencing a condition like ocular melanoma or having to undergo radiation treatment. With age, both affected and unaffected eyes are also at risk of common conditions, as I mentioned before, such as cataract, glaucoma, and macular degeneration. Continuing to have routine follow-up visits allows your stronger eye to be supported, as well as to offer treatments if necessary to your affected eye so that you may maintain the best possible health and vision. With ocular melanoma, as with any cancer, there is the risk of cancer spreading to other parts of the body. This risk is present even though the initial tumor is completely killed with radiation or other type of treatment. We call the spread of cancer metastasis or metastatic disease. In the case of ocular melanoma, the metastasis almost always involves spread of the liver. We don't know exactly why the liver is predisposed to this effect, but we do know that there are things that can be done to predict the risk of metastasis for a given patient. So which patients may be more at risk of developing metastasis to the liver? We can find out information from the primary tumor at the time of treatment when we take a sample or a biopsy of the tumor. The information we get from the biopsy can tell us your prognosis or your risk of the cancer possibly spreading. When we combine this information with other factors such as your age, your tumor's size at the time of treatment, we can better understand the risk of the cancer possibly spreading to other parts of your body. The process of taking information from a biopsy is called molecular prognostication, and it gives us information about the possibility of the tumor's risk that it might spread to other parts of the body. Molecular testing has now become a standard of care at the Stein Eye Institute and now, because of our work, at many other centers around the world. However, if you are not interested in receiving this information, you may request not to have the biopsy. We have performed research in health psychology in ocular melanoma at the Stein Eye Institute and learned that by and large, most people want to know the information about their possible risk of metastasis, even though it may not affect their medical treatments. We learned from speaking to patients like you that the more information people have and know about their prognosis, the more in control they can feel in relation to their health, which ultimately helps people take better care of both their mental and physical health. That being said, we recommend the same course of follow-up visits after treatment for every patient with a history of ocular melanoma at the Stein Eye Institute, regardless of the result of their molecular prognostic testing. Why is this? It is because that prognostic testing can only give us a general risk of information, and it is by no means a guarantee that metastasis or lack of metastasis may happen. For example, we know that even patients who receive molecular testing who have a high risk of metastasis may actually have a better prognosis than the tests reveal, especially if their tumor was small at the time of treatment, because the size of the tumor at diagnosis has an important role in the risk for metastasis. Furthermore, every individual is different, with a unique set of variables that may affect their health, their immune system, and how they do with their cancer. One's medical history and overall health, including mental health, are important considerations for thinking about one's risk of metastasis. Therefore, the molecular prognostic test is just one piece of information that can be helpful in predicting metastasis. We do want to make sure that every patient, therefore, has the opportunity to detect cancer recurrence or metastatic spread of the cancer when possible. When people have more options available to them, especially when metastatic disease is detected early, there are more options and opportunities for treatment, because in early detection, when the tumors that spread elsewhere are found small, there are many more treatment options open, as well as potential opportunities to enroll in clinical trials. Therefore, we recommend that every patient, regardless of whether they may be considered at low risk for metastasis or high risk for metastasis, undergo these same general recommendations for screening. At the Stein Institute, we recommend that people have abdominal imaging studies done every 6 months indefinitely. These types of screens or imaging studies usually include MRI scanning, CT scanning, sometimes a PET-CT, or even an ultrasound, and they are done to focus on the liver and look for any signs of possible metastatic disease. This is done to give you and your doctors confidence about the spread of metastasis and the best opportunity for treatment should this be necessary if metastatic disease is discovered. When caught early, metastatic ocular melanoma to the liver has a higher chance of being successfully treated with surgery, chemotherapy, radioablation, or maybe there is a new treatment, as we have seen in the past several years. There has also been important developments, as I referred to. For the first time ever, there is now an FDA-approved systemic chemotherapy that has been shown to improve survival with patients specifically with ocular melanoma metastasis. The recommendation we make for twice-yearly scans are done in an abundance of caution. As your doctors, we want you to have all the resources possible to promote your quality of life and longevity. And we also want this information to be learned sooner rather than later. That is, the possibility that the cancer has spread. The sooner that we know what is going on in our bodies, the more control we have at making decisions and choosing possible treatment options that will help us move forward. At times, you may find that your oncologist or your insurance company may question the need for twice-yearly scans. Oftentimes, oncologists and insurance companies may not be familiar with the nature of ocular melanoma and its associated risk of metastasis. If you do run into difficulty, please reach out to your team or any of the doctors who provide your care so that we can help provide coverage and supporting information for these recommendations. It is possible that your oncologist may recommend switching to yearly scans due to success at this point of time, if many years have passed since your initial diagnosis, and also if your risks are low. If this is the case, the oncologists that work closely with us recommend that you may alternate between MRI scans or CT scans every 6 months. It is important to discuss the possible protocol you may follow with your oncologist to suit your individual needs and risks. Finally, if you are a long-term survivor of ocular melanoma, for example, your treatment has been over 10 years in the past, your oncologist may recommend switching to yearly frequency for these types of scans. While this is an area of controversy, it does appear that risk for metastasis may decline after 10 years, but this risk does not go to zero. We do have patients that have developed metastatic disease even decades later. So our best advice, if we want to be proactive and preventive at early detection of metastatic disease, is to continue, if possible, with twice-yearly imaging. Again, this recommendation is in order for you to have the most control over your health and well-being. We feel that the more information you have about your condition, about how you are doing, the more control you can have over your life, your health, and your wellness. Today we have shared information about ocular melanoma, including what your doctors can do to promote your health across the treatment, recovery, and your survivorship journey. We understand the challenges that you may face when it comes to your eye, your vision, how you function, your physical health, and your mental health. In the next video, we discuss what you can do to place your health as much as you can in your own hands, despite the uncertainty that exists when dealing with this condition.